Have you ever heard of ablutophobia? It's a term that might not ring a bell for many, but for some, it signifies a life-altering fear. Ablutophobia, in essence, is the fear of bathing, washing, or cleaning. It's one of those specific phobias that doesn't come up in everyday conversation, making it somewhat of a rare find in the vast landscape of human fears. But don't let its uncommonness fool you. Ablutophobia is as real and as debilitating as any other phobia. People grappling with this fear can find the simple act of bathing or washing their hands paralyzing. It's not just about a distaste for soap and water, it's a fear that can severely impact a person's life, from their personal hygiene and health to their social interactions and self-esteem. In the grand scheme of things, ablutophobia may be a lesser-known phobia, but it carries significant weight for those who live with it. So, what causes this unusual fear? Ablutophobia, like many phobias, often stems from a traumatic event. This could be an incident related to bathing or cleaning, particularly during childhood. Imagine a child having a distressing experience while bathing, such as slipping in the tub or being scalded by hot water. The fear imprints on their mind, and bathing becomes a source of dread, thus triggering ablutophobia. However, it's not just traumatic experiences that can cause this phobia. General anxiety disorders or obsessive-compulsive disorder can also be precursors. In these cases, the fear may not be directly related to bathing itself, but the act becomes a focus of the individual's anxiety or compulsive behaviors. Interestingly, ablutophobia tends to occur more frequently in women and children. The reasons aren't entirely clear, but it's an important factor to consider when we talk about who's most likely to develop this phobia. But how do you know if someone has ablutophobia? Ablutophobia manifests through a variety of symptoms. It can be identified by conspicuous physical signs such as dizziness, breathlessness, nausea, or even profuse sweating. But it's not just physical. Ablutophobia also has emotional symptoms that can be just as revealing. These might include an intense fear or anxiety at the thought of bathing, avoidance behavior where bathing or cleaning oneself is concerned, and distress that disrupts daily functioning. Fortunately, there are treatments available for ablutophobia. There's hope for those suffering from ablutophobia. Treatment options abound, with some of the most effective being cognitive behavioral therapy, which helps in reframing the way one thinks about bathing, and exposure therapy, gradually increasing contact with water to reduce fear. Medications can also be prescribed by a psychiatrist to manage severe anxiety symptoms. It's crucial to remember the importance of seeking help from a mental health professional. Remember, even the most uncommon fears are valid and help is available. To recap, ablutophobia is a specific phobia that involves an intense fear of bathing or cleaning. The root of this fear often lies in traumatic events like a near-drowning incident or a forced bathing experience. Symptoms can range from anxiety and avoidance to full-blown panic attacks. Treatment typically involves cognitive behavioral therapy, exposure therapy, and sometimes medication. Never underestimate the impact of any phobia on a person's life. Understanding and empathy make a difference.